As we all know that heart is a very important organ of the body, also known as the engine of the body. Heart is the only part which works round the clock without taking any holidays. The day heart takes holiday, that will be our last day on this planet. So a person in our department, in our institution also does, if a person does not take any leave, he should be respected. The same applies here to the heart, as we all know that it works round the clock since the time we are born till the time we are dead. So we should respect our heart. When I say that we should respect our heart, it means we should listen to heart's music, also known as heart sounds. But I literally mean about heart music is, in layman language, what are the things which makes this heart music sweet, melodious, pleasing to the ear, is that we should adopt a very healthy lifestyle. Yesterday I was watching a TV interview by a famous film celebrity, which categorically says one thing which should learn from our Bollywood stars. They have got beautiful bodies. Is that one should avoid eating after 6:30 p.m. in the afternoon. This is not a new concept. This has been our age-old tradition. Don't eat anything after sunset, because we all know that when we rest, our whole body is resting. If we eat at 10 o'clock, except stomach. And in the morning, when stomach is resting, our whole body is moving, we again eat. It means stomach does not take rest at all. It indirectly puts a pressure on our metabolism, which indirectly affects our heart. The first golden rule: don't eat anything after 6:30. If you want to eat jalebi, you want to eat parantha, you want to eat fried food, at least if you can't avoid it, take it in the lunch or in the morning when our body is mobile, body is totally active. This is one thing. Second is, always go for long walks. The recommendation is 150 minutes of walk per week, but the more the better. If you can walk 1 hour a day, or you can jog, that will literally reduce the incidence of chronic diseases like diabetes, hypertension, heart diseases, as well as famous dyslipidemia. Incidence of dyslipidemia is very, very less in persons who are active physically. Third thing is, one should totally avoid smoking. The smoking is not only injurious to our lungs, it is injurious to the whole body. It is cancerous, it promotes MI, and it is addiction. It is an addiction, we all know. Fourth thing is regarding fats. There has been a lot of controversy in the past regarding what should we eat, what should we not eat. Thankfully, as per 2015 latest ACC/AHA guidelines, restriction on fat is not that stringent, that one can eat fat in moderation, provided one is also doing exercise. It means our forefathers, we used to hear from our parents that they used to eat desi ghee, which was actually not wrong as per today's 2015 guidelines. One can walk, if one can consume that saturated fats, it is indirectly beneficial to our body, or at least they are neutral to our body. The problem arises when we mix carbohydrates with fat. Sweet white sugar, which we take in sweets, in tea, in milk, that is poisonous. If we want to curtail, want to reduce the incidence, real incidence of heart disease, Don't eat white sugar irrespective of your age, irrespective of your diabetic status. In any form, sugar, that is the rule now. Don't eat sugar, that is dangerous, promotes diabetes, promotes heart attack, promotes obesity, promotes depression, promotes craving, promotes overeating, promotes lethargy, promotes sleep, promotes it and anecdotal reports also linked it with cancer. Hence, it is better that we should avoid adding sugar, adding salt, avoid sweets, avoid canned fruit juices, take natural things as far as possible. जितना हो सके नेचुरल सैलेड्स, गाजर, मूली, टमाटर, खीरा, ककड़ी, like this, and vegetables, dals, curd, these type of things, they are good for health, indirectly good for heart. Regarding treatment, once you are having heart problem, now there has been sea change in the treatment of cardiac diseases. Right from our days in early 80s, when there was nothing available in a case of heart attack, then gradually the series of advances, then gradually thrombolytic therapy came. After that, fibrin specific thrombolytics came. Now the era is that of an intervention. The artery is blocked, immediately that needs to be tackled without losing time. Here in our center, we do repeatedly, in a very short time, door to balloon time in our institute is not more than 45 to 50 minutes. That is probably, I can say, best in the world. By doing this, as we know that each second counts, time is muscle. We are saving our precious cardiac muscle, and we achieve total active life after the angioplasty. Patient is totally asymptomatic if it is done in a timely fashion, in a rapidly fashion, in an effective way. Then patient can lead a virtually normal life even after heart attack. There is nothing to get scared. Very high level treatments are available nowadays in the market, but the crux is it should not be treated at home thinking that is gas, it is gastritis. This can be sometimes catastrophic, and immediately expert medical advice has to be sought. If you have got slightest symptoms like chest discomfort, chest pain, sweating, uneasiness, breathlessness, palpitation, syncope, things like that, then one should not neglect it. One should not self-medicate himself. It can be catastrophic, it can be dangerous. Immediately rush to your nearest medical facility available, and at a suitable center where you can be treated properly. These are the few things which should be adopted by everybody, and after this procedure it is very, very important, equally important, to take regular medication, which as per the advice of your doctor, that regular medication is equally important. But along with medication, lifestyle modification, as I have enumerated earlier, regular walks, no sugar, control your BP, control your diabetes, control your weight. These things are equally important. If we practice all these things, and then we can achieve our target of keeping our heart healthy. And I will like to repeat the same sentence which I told in the beginning, that one should avoid eating anything after 6:30 to 7 in the evening. Thank you.